Hi, everyone, and welcome back to this episode of the Feeding Hour. In this episode, we talk about babies' efficiency at the breast. So, this means how we know how much milk they are actually getting when they are nursing. We talk about common concerns with new moms about milk supply and how concern for milk supply is the number one reason that moms stop nursing before they'd like to stop nursing. We talk about the importance of understanding what efficient feeding is like and how can we tell how much the baby is getting. Thanks so much for listening. We're so grateful for all of you who do listen. And if you'd like to give us feedback, feel free to email us at the feeding hour podcast at gmail.com. If you enjoy what you're hearing, feel free to give us a rating on wherever you listen to this episode. Thanks so much. Happy feeding.
Welcome to the feeding hour. All right, we're going to jump right in. We're talking about efficiency at the breast. So, Abby, what does it look like for a baby to be efficient at the breast?
This is a great question. I think it comes with a lot of myths and just lack of understanding. With this, we're also going to talk about infant oral motor function and the because it kind of goes hand in hand. I think one thing is a lot of people early on in breastfeeding will be worried about how much the baby's transferring. They're like, how do I know that the baby's actually getting milk? Because if you have done any supplementing or just thinking about bottles, you can see the milk directly go into the baby's mouth. So it can be confusing to know, okay, is my milk in? How much milk is being transferred? How do I know when the baby's full? How do I know when to switch sides? All of that. And a big reason that women stop breastfeeding a lot of times is perceived lack of milk supply. So they just think they don't have enough milk or they think the babies must not be transferring. So to answer your question, what does it look like for the baby to be efficient? And it changes over time, but with a newborn, it's that they're milk drunk and full after a feeding, that they're actively sucking with a deep latch at the breast and they're actively sucking. And I don't want to say times because it does change. Like a newborn isn't going to be as efficient at getting the milk out quickly as a 3 month old. But I would say we want feedings to be done in like 30 minutes, just because the baby doesn't have that much stamina. So I would say it could be anywhere from 15 to 30 minutes could be considered in the range of normal for efficiency for a newborn. Um, but it's really about what the baby looks like and if they are transferring the milk enough to be full until the next feeding in a timely manner so that you don't feel like the baby's snacking all day or hungry an hour later. And that would be more of an inefficient baby.
Okay. So, so when you say milk drunk, what does that look like?
That's a great question. Milk drunk is kind of a colloquial, probably lactation term, but it's kind of when the baby's like their body even like goes limp and their arm, if you lift up their arm, it like falls back down, or they have milk dribbling out of their mouth and they're just tired and falling asleep because babies only have a little bit of alertness in the beginning days and weeks. And so they're kind of using all their awake time to eat. And so usually after they eat, then their like wake window is over and they're like, okay, I'm hopefully efficiently draining the breast and drinking the milk and then falling asleep and I'm full and I'm satiated. And that would be like a great efficient baby. So like as a lactation consultant, I'm documenting like, wow, like they transferred and it could be amount driven, maybe they transferred anywhere from 3 to 5 ounces once they're like 2 weeks old. Early 2 weeks, they're working on getting their milk supply in. So they might not transfer as much and still be considered efficient um, because their stomachs are so small. They're kind of building up to that max quantity. But then once they're like 2 weeks old, I want them to efficiently be transferring like 3 ounces at least, usually.
Okay. So just to summarize, like one would know that their baby's getting milk, right, which is likely a concern
Hmm.
perhaps of new moms,
Yes.
is if they are sort of like sleepy afterwards or like feel like limp in the best way,
Yeah. You
tired, like
see the
milk.
milk.
Yeah, so they're
Mhm.
satiated.
And you feel your breast getting less full and you see that they're actively sucking milk, not just falling asleep. The caveat is, and I think we've talked about this on other episodes, is that a really brand new newborn might, suck a little bit and get sleepy before they're full and before they've transferred a lot of milk. That would be the red flag if they're like too sleepy. But yes, if let's talk about like 2 weeks and onward, like the baby's back to birth weight, they're doing well, but maybe they're not quite as efficient yet. Maybe they have some oral motor concerns, or maybe they were a little premature or a late term preemie, and so like 37 to 39 weeks, and so they're just working on getting more efficient. So breastfeeding is going okay, but maybe they weren't gaining weight quite as quickly, or feedings were just taking like 45 minutes, and you're just kind of questioning like how do I get them to be better at this and faster at this so that I know I can trust that they're transferring the right amount of milk and they're growing and all of that. I feel like that's kind of the target audience that we're going for here.
And talking about the timing of feeding, like one thing I find interesting when we talk about like the 15 to 30-minute range. So if you have a newborn and this I'm gaining my knowledge, so I'm able to contribute a little bit or ask a little
Oh.
bit specific questions.
Uh-huh.
Um, but like the baby's fed continuously and then they come so after delivery, when the baby's born, would some feedings be because you're just like we talked about in the, before to know, like what to know before birth, if you're just putting them on the breast continuously, wouldn't those be short feedings?
Yes, that's a really good point. That's why it's like the advice changes so much for the first 2 weeks versus like 2 weeks and onward, I would say. So yeah, brand new baby, like we don't really care how efficient they are, right? That's why we're going to give them so many chances to breastfeed. That's why a lot of issues come actually if you try to feed baby only every 3 hours. That's actually not enough because they're not efficient yet, right? Only every 3 hours is only 8 feedings a day. Like, let's say they weren't efficient that feed, they only transferred like an ounce, or not even like 20 ml or 10 mLs or something, and they're hungry. So you need to kind of account for that inefficiency that's normal for a newborn. Um, and that's why we feed them like on demand 8 to 12 times a day, even more if they need to. Then, as we're establishing our supply and like um, kind of expecting them to maybe breastfeed and then go a stretch of sleeping or going in a car ride somewhere, or like as we're trying to get a little bit more back to doing other things than just feeding all day, um that's when we're hoping that they're gaining their efficiency, um maybe in like weeks like 2 to 3.
Yeah.
In the best case scenario, like a lot of times second time moms, like they have such a good milk supply that because every pregnancy, you lay more breast tissue, and sometimes the second time you have your milk comes in very quickly and you have a lot. Those newborns might be super efficient, and that's when you get the blissful, like, I just breastfed and my 5-day-old already is back to birth weight and like transferred 3 ounces already, and then they sleep really well. That's when you just get lucky and you get an efficient brand new newborn, but that's not always the case.
Awesome. And of note, like, so you've got sucking and then you've got suckling, right? So,
Mhm.
okay. So, because like a brand new newborn, just thinking of the moms who like maybe exactly have a baby that's under 2 weeks, like sometimes your baby's just going to latch and is just practicing and maybe not transferring much. And that's considered suckling. But
Suckling, or like non-nutritive sucking, we call it, or just, yeah, they're kind of like, people say using the breast as a pacifier, but really the breast is the original pacifier, right? So you're
I
just
know.
kind of just, just getting familiar, practicing, like you said, like, and as long as that's not hurting mom because they're doing a nice wide latch, that's great. That's skin to skin. That's still stimulating your breast, telling your body to make milk. Like I had a mom this morning who was, the baby was born premature, so at like 34 weeks, but now the baby's closer to 38 weeks. So they're doing awesome. And that baby's still working on efficiency though. So a lot of times they're hungry at like 2 hour mark or 2.5 hours since the last feeding. They get on and they get on with that deep latch and they're going and they're doing such a good job. And then they get tired a little bit. So because they're still working on that stamina. And so then they start the suckling. And you can kind of look at that and that's part of how you assess if it's a good feeding or if you're going to need to supplement at all or anything. Um, but you're looking and you might see them slow down and kind of get a more shallow latch and where they're just nibbling a little bit, falling asleep. And then that's when you would probably take them off, relatch the other side, see if you can get them more active again.
Okay.
Hmm.
Cool. And
Yeah.
then I've heard, and correct me if I'm wrong, that like also you can just tell if you hear them swallowing. Like you
Yes.
can see on an infant if they are swallowing or not.
Yes, you
Which
can see their jaw movement and you can hear gulping sometimes, especially if mom has a good supply. Um, and you can see milk, dribbling out, or like when the mom is trying to get them latched, you see her breasts are already leaking a little bit. So that's a good thing if you see milk moving.
yeah. And just like a note, this is why speech therapists are like there's a lot of crossover between
Hmm.
lactation consulting and speech therapists because we have the swallowing knowledge. And so it's cool and interesting to be like, yeah, the same framework that applies to swallowing in terms of, you know, older
Adults
people
are, yeah.
is similar with some caveats to infants that are swallowing.
This
Um,
is a good, I'm glad you brought that up because that's a knowledge that I think we have as SLPs is like the suck, swallow, breathe pattern. Like everyone, adults and babies, when you swallow, you close off your airway to protect your airway so that no food or water goes the wrong way. So babies are trying to do this for the first time. So they're trying to coordinate breathing, which they're new at doing, and then also swallowing and closing off their airway. And but their main thing is to breathe, right? So eating and breathing are like these two competing things that they're trying to figure out how to coordinate. And hopefully at 40 weeks, when all their reflexes are like ready to go for feeding, and after, a natural vaginal delivery, like that's kind of sets them up for success with feeding. But if they're premature or induced or C-section or all the other things, their reflexes might not be ready. So they're not going to be as efficient at that suck, swallow, breathe pattern. And so that does impact efficiency because then they'll do this thing where they suck, 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 suck because they're like, I'm hungry. I'm trying to do this. But then they forgot to breathe. So then they'll pause and be like, and you see their little body trying to catch up breathe. It's called periodic breathing in premature babies, but yeah, I think that's a huge part of efficiency is like if you can't coordinate suck, swallow, breathe, then you're not going to be able to take those natural pauses and then efficiently take the milk and then be done in 15 minutes. Like you might need
yeah,
longer. You might need more pauses. You might fatigue and then need to relatch again. Like a lot of times we're helping them work through their efficiency problems in the beginning.
yeah, yeah, that makes sense. Like, so in terms of a lot of it depending on birth, but if you had perhaps not the
Most
straightforward
ideal
vaginal
birth.
birth, yes, then your beads might take up to 30 minutes, but it shouldn't take longer than
Longer.
30 minutes because the baby is fatiguing. If you did have a straightforward vaginal birth, then it should be like 15. Like it shouldn't be long. Is that what am I
Yeah, yeah. Yeah. And I think the timing is so hard because, you know, you kind of are reading your baby's cues and you might notice that they are actively sucking for the 15 minutes, but then they fall asleep but they keep breastfeeding. So keep counted as like they're on the breast for like 45 minutes, that would be fine. It's just if you kind of know when it's not efficient because and maybe you don't because you're a brand new mom, but like if you feel like feeding is taking forever and you're like they would just keep going and every time they come off then they cry again and they're hungry again and they just are in this pattern of like never feeling full and satiated,
Yeah.
and always still crying for more, I think that's when you know, or if you're having to supplement at all, or if you're worried about your milk supply, like anything like that are kind of red flags that they might not be as efficient as they should be. Um, and if they are, but yeah, the good green flags are if they're like they're actively sucking, then they get tired, you flip them to the other breast, they do that one for a little bit, then they come off, and then they're kind of full, and they can make it maybe an hour and a half or 2 hours to the next feed. And then hopefully that gets longer and longer because then they'll get more and more efficient. I mean, a 4-month-old baby is super efficient. If all their oral motor function is great, they're like, suck, suck, suck in 10 minutes, and then they're done. And you still might offer them the other side, but maybe they got it all from the first side, you know?
Uh,
They get really fast. And then that's when breastfeeding becomes so easy, is when they're like just on demand, but it doesn't take long. So it's not taking your whole day. It's just like this kind of easy thing that floats through the day. And you're not really
yeah.
worried about how long it's taking, like not looking at a clock. It's just efficient and easy.
And if you think about like other skills kids learn, you think about reading, like they're really slow at first. Like and no one's like, hurry up, like we're gonna do this and whatever. It's like they're going to be slow, but then as they practice reading more, so meaning you have to put the baby on the breast, they can't go pick up a book.
By themselves. Yeah.
Right, exactly. Then they get more and more efficient and eventually they are just reading up a
Yeah.
storm.
I actually love that analogy because, um, my husband always gives really good analogies too. So I love when people do this because, um, yeah, like you would never expect a baby to just, or a toddler to just know how to read. You know that it takes like 4 years of reading to them before they even start to notice that there's words on the page. And then you're like training them how to read, right? And all of those little building blocks lead to them actually sounding out a word and knowing a letter and knowing the sound. But yeah, that's the same thing. Like we would expect it to just keep getting better and better, but we're kind of helping manage it at first. That's why we're like waking them up when they're brand new babies, to eat, because we're like, well, if it was up to you, you'd just keep sleeping. You're probably not wanting to wake up and do the work of eating yet, but we're going to keep helping you along until we know you're on the right track with it.
And holding books, like just keeping the analogy going because we
Yes,
were
I love it.
like you will give them it and they'll just like playing with it. They're like turning it upside down. They're seeing how letters go. So it's like,
Mhm.
yeah, there might be that is that suckling at the breast. Like
Mhm.
there's not doesn't have to be this huge concern because they're just getting familiar with your breast. They didn't have that in the womb,
Yeah.
you know?
In the womb, they just were getting fed, not even working at all for it, right?
Yeah, yeah, just
Umbilical cord.
practicing that swallow. Um,
Um,
okay, so
you go, you go.
okay, well we can take it two ways. Go down the milk supply and like why that maybe shouldn't as much be a concern for
Mhm.
moms, or we could talk about what it looks like to be inefficient at the breast. Or we could do both.
Okay, well, they kinda go together because so if your baby is born and latches on and feeding 8 to 12 times a day, and you have no, pre-existing conditions, thyroid issues or diabetes or PCOS or the issues that could impact your milk supply in any way, if so, just work with a lactation consultant, it will be fine. But like, let's say everything's going just great and you are latching the baby but you're still like, okay, am I doing this right? Like, I don't know. Um, then yeah, if everything is going great, they should bring in your milk supply and they should be getting a deep latch and stimulating your breast to tell your breast how much to make. If they are inefficient at the breast or have oral motor issues going on, and you don't know, well, there are some red flags for it, like pain at the breast or your breast feeling really engorged and not feeling drained, like after you breastfeed, or the baby getting really sleepy or not, um, like still seeming hungry after, all those things, and not gaining weight appropriately when the pediatrician checks, all of those things. Um, but if that stuff is going on, then it's like, okay, my baby's inefficient at the breast. Um, that could also impact your milk supply because now the message that your body is getting to make the milk is diminished because let's say the baby's only taking like an ounce total, but the baby's 2 weeks old now, your body's only making an ounce each
Yeah.
time, which would not be enough. So babies to give people a gauge, I feel like this was helpful when I was a new mom. Like just knowing that like it's a big range, but like 20 to 30 ounces a day is kind of a normal milk supply. So really like an ounce an hour. So like 25 ounces a day would be kind of a full milk supply at 2 weeks. Um, so if you're pumping before then, it doesn't need to overnight be that much. Don't stress.
Yeah.
But, like, we're working towards getting to where and it'll change, like, if if you were never pumping, you would never know how much milk you're producing, right? Um,
Okay.
but but the baby would if you think about 8 feeds a day every 3 hours, so that's 8 times 3-ounce bottles is 24 ounces in a day. So that's kind of a normal just baseline is, like, that's how much babies kind of take if they're taking bottles at 3 weeks old. They would take 3 ounces every 3 hours.
And if you're exclusively breastfeeding,
Mhm.
then it might be like, okay, hear your baby swallowing. Their milk
Yes.
drunk after the feeds.
Yes.
They are okay. So placement, right? When we talk about deep latch, we're
Mm.
talking about it's a comfortable latch for both mom and baby. And sometimes the baby just needs to be closer to the breast to do that.
That's
It
literally what fixed
in the
it for
parent.
the mom this morning. Like, literally,
Yeah.
I just put her belly to belly closer, and then her the latch stopped hurting, and the baby got deeper and
Yeah.
transferred better. Yes.
Yeah, and, like, recognizing this is something that was so interesting to me because it's so true. Like, it's called breastfeeding, not nipple feeding. So, like,
Mm.
your baby is not on your nipple. Like, they are on your breast, and
Yes. They
it's
should
so
get
that
the full areola in the mouth. They should get,
yeah,
like, a big amount, which is hard if you are engorged. Like, if your breast is very firm and it's, like, day 3 or 4 and you're trying to get them on, it's hard to do. So sometimes that's why we'll say, like, hand express a little, try to get it softer so it can fit in their mouth, their tiny little mouth. It all
yeah,
gets easier as they get bigger, as you get less engorged.
and they learn,
And they learn how to get a deep latch. And if you have that lipstick shape afterwards or any pain means that the baby is putting your nipple on their hard palate. And that's in the front of the mouth and that's what's hurting because it's not
yeah,
meant to be there. It needs to be back all the way to their throat, their soft palate. And that's what then we this will lead nicely into an oral motor function conversation.
there we go. So probably farther back than you might think, like,
Yes.
is where your nipple actually needs to be.
Yeah, even if you're bottle feeding, I see so many people just putting the tip of the nipple in their mouth and the baby's like sucking like a straw and they're pursing their lips and they're not developing their cheek muscles. Like you should have and that's why I love that even flow balance bottle nipple because it's so wide that it makes babies like phalange their lower lip down, phalange their lower lip up, get a really good lip seal,
Yeah.
then far back in the mouth and then it's a wide sloped bottle nipple so that, like a breast, it's all the way back in their throat, and then they can really use their jaw and their tongue properly to eat to suck and suck, swallow, breathe, coordinate it well,
Yes.
not get air in, not get gassy, all the things.
Well, I love that, you mentioned a straw because, like, yeah, babies don't suck like we suck through a straw. Like, they don't when we talk about suck, swallow, breathe, they're not, like, just going like this and sucking. They're, like, transferring milk by moving their jaw, yeah, pressing, and then, um, like, it's not a
Creating a
munching.
vacuum. Yeah, they're creating a
Yeah,
vacuum
yeah,
seal and they're cupping
exactly.
their tongue. And that's the thing that I think we know really well as SLPs too is like you need lip seal, jaw stability, and then tongue cupping. And you need a vacuum seal. You need like the tongue to cup around the nipple. And then you need the lips to be holding that seal. If air is getting out the sides because you're weak or you don't have a deep enough latch, that's where they get air in and they get gassy.
Yeah, and reflux. So that might sound like clicking at the breast, right? Like if they're getting
Mhm.
there. Okay.
So that's why we say the big red flags for oral motor function, or people might say tongue ties, but it's really just, it might not even be the frenulum that's the problem. It might, and we have another episode all about tongue ties and oral restrictions. But really, most babies I see need to work on their oral motor function in some capacity, whether
Yeah.
it's phalanging out their lips better to get a better seal, um, and then by default get a deeper latch. Um, cupping their tongue properly. So, like, one exercise that I love doing with parents is have the newborn like suck on your finger. Um, so you're pressing up into their palate, which activates their sucking reflex. And so they'll suck and they'll cup their tongue around your finger like a U, and then you pull down their chin and you're tugging, like tug of war, and you're seeing if they can hold your finger with their tongue. And if they can, that means they have really good tongue and jaw dissociation. And that means that like their tongue and their jaw aren't relying on each other they're not using their jaw to like chomp down and suck. They're actually using their tongue properly. And that's a really good sign for good oral motor function. If you are pulling down their chin, so you're like taking their jaw down and then they immediately click and lose the latch, then that's like, ooh, okay, they need to work on their jaw stability, their tongue cupping, their sucking,
Yeah.
um, and then and that can happen on its own, or sometimes you do need a tongue tie release in those cases. Um, and then the lip blisters is another sign that just to me, it's not necessarily like, oh, you have a lip tie. It's just like, oh, your lips are working hard to to get this deep latch and flange out. So I'm going to keep an eye on it. I'm going to keep watching. Is it flexible? Are you getting a deep latch? Are mom's nipples okay? All these things. And then if it's still happening and it's really hard and they're always turning their lips in, then maybe it is a lip tie. So it's never like you don't go first to all these restrictions. You just go to like, let's improve the oral motor function in general, do some exercises to help it. And then if it's really a structural thing, then it's a structural thing.
Yeah, that's such a good point because well, I mean, just like anything in speech pathology, like, is it functional? We want to see if the suck is functional, just like we want to see, all right, is their language functional? Like it's like a lot of people don't see a child's language problem until they get them to school because their language has been functional and up until now, and now there's all these new words that they need to learn or that they're maybe slower to learn or something like that. And so it's working on that. It's the same thing with breastfeeding, like, okay, are they transferring milk? If they're transferring milk and their tongue is a little more restricted than perhaps your sister's baby,
Yeah, then fine.
keep it moving. Yeah.
That's
Um,
what some people say, like, we don't even diagnose it as a tongue tie. It's a functional diagnosis. So, like, if there was never a problem and your tongue is resting on the roof of your mouth and you're breathing through your nose and you're sucking and breastfeeding well, then no one's even looking at your tongue, right? At your frenulums. Like, but yeah, and it obviously it is fine then. It's just if you start seeing the red flags, and the first red flag is problems with breastfeeding, usually some kind of problem, just because that's the first thing we need to use our tongue for. And it's important to figure out what that is because a lot of people are like, oh, well, I'll just exclusively pump. And it's like, okay, that is fine. That is always a choice. But then we don't get to the root cause
yeah.
and then it might show up again later. It might not, but it might. And yeah, so always looking at just oral motor function for sleep, feeding, breastfeeding solid foods, bottle feeding, even just making bottle feeding more like better oral motor function for bottle feeding. Like
Mhm.
if you're saying, "Oh, my baby's really colicky. Yeah, breastfeeding didn't work out. We're just exclusively pumping, but like yeah, my baby's just so gassy, so colicky, blah blah blah." It's like, "Okay, well, maybe if we optimize the bottle feeding, maybe that's better." Maybe not, but I feel like it should be one of the diagnostic things. Like for me, for babies, it's like looking at obviously their overall well-being and like, is there like a sickness or a condition or issue going on
Or birth,
uh,
how was birth?
from
Because
birth? Yeah,
there's
right.
so much. sorry to
There's so
interrupt,
many
but
things.
yeah, and there's so many cranial nerves associated with swallowing, sucking, like,
Yes.
not just swallowing, but transferring, eating, like, just in humans.
Like
And so
head shape, yeah, like how their jaw, like how tight they are, all those things.
yeah, and so, like, if they're premature, like, and we talked about that in the previous season, is your baby's brain is floating, in terms of gyri, and so it's like, yeah, if there is, like, necessary or unnecessary, whatever, interventions during birth, or your baby is premature, then that's where we see the disruption,
Yes,
in
totally.
feeding. So,
Yes.
no.
So, yes. So if yeah, I feel like that is the main, like that's setting the stage. And then when you're figuring out like colic or like an issue or efficiency issue or whatever you're diagnosing, the first thing you would look for is you would assess for mom's milk supply, make sure that there's no problem there. So maybe the baby is efficient, but they're just only getting what the mom has. Then, and if there's not enough, then you need to supplement, right? Um, then, or you need to make a plan to try to increase the milk supply, whatever. Then you look at the baby's oral motor function. Okay, how are they doing at the bottle? How are they doing at the breast? How about on a passy or on your finger? You assess all of those things. Then if it's still not that, then I move into like, okay, is it like a GI thing? Like, are they having a sensitivity to something the mom's eating or the formula? Or, is there more of a allergy or GI or milk sensitivity reaction going on? Another thing that maybe simultaneously I'm looking at is like, and this kind of goes along with oral motor function, but like, is it a body thing? Like, are they really tense? Do they need body work? Do they need like PT, OT, baby Cairo, like things like that to help their neck and everything relax more? I'm trying to think, but those are kind of all the different routes I'm looking at to see. And that's why you're going to get, if you see a specialist that has a lot of training in these things and like tongue ties or that is an OT or an SLP or, you know, and IBCLCs could also have pursued all those trainings if they were kind of that's their main credential. But I just feel like really finding someone that's really holistic and gonna look at all the areas and not just be like, oh, it's a reflux, it's normal, oh, it's colic, they'll grow out of it. Like
Right.
there's so much we can do to help babies thrive. And like, if feeding is going well, then sleep's probably going well, then tummy time's probably going well, then development's going well, then mom can take a stroller walk, or the baby can take a nap in the carrier and the mom can play with her other kids. Like, I feel like when there's an undiagnosed thing going on or something wrong with oral motor function or feeding or something, then like that just takes over and bleeds into all these other
Yeah.
problems.
Yeah, like, you can find IBCLCs that specialize just in reflux, or just in
Yeah.
colic or whatever, and it's like, why exactly wouldn't you in the age of, like, being able to find people on social media and whatnot? Um, and also check, like, being like, "All right, what's their credentials? What's legit here?" Okay, and then going back to what you said about, like, an infant at the breast. So can a baby be latching, have a good latch, and the mom still have supply issue? Because isn't if the baby has a great latch, like, can the mom actually run out of milk while the baby is having a good latch? And
But that's a really good question. So, typically, if so, there is something called like primary low milk supply. So, like, the mom has something wrong where, let's say you had a breast surgery, like a breast reduction. Sometimes, not always, but sometimes that can make you have a lower supply. Or let's say you have a thyroid condition or sometimes with PCOS or sometimes with just something hormonally, like you actually don't produce as much milk. Or if your breasts are like very tubular, you'll learn this in the CLC course. Like there's some women just don't go through the development of developing enough breast tissue. So you just have like insufficient breast tissue. And hopefully your OB caught that, during your pregnancy. So then they kind of give you a heads up that, hey, it might be hard for you to produce enough milk because you can tell by looking at their breasts.
yeah,
So there are reasons that the mom might just have low milk supply, but I think more commonly the mom has the ability to produce the milk, but they need the baby to put in the order per se. And we're kind of talking about reasons that the baby might have struggled to do that or and how you would know that they're putting in the right order.
Yeah, and when in doubt, like, as a mom, you can just, I mean, like,
Get a
try to,
lactation.
yeah, and like try to balance your, well, enough to say, but like you can try and maybe pre-pregnancy, like
Mhm.
balance your hormones, and then when you get to pregnancy, since self-efficacy is like number one in breastfeeding, just be like,
Yeah,
all right, I can breastfeed, like I can
I
breastfeed,
can do
and
this.
then right, and then if something comes up, you're like unsure, you're not seeing like, you know, milk drunk after your feeds, or you're not seeing them swallow,
The
or
weight
things like that,
gain, yeah,
then you can get help. But you shouldn't be scared.
assuming that they're not gonna have enough milk. Yeah.
Yes, exactly, because that is going to hurt your breastfeeding journey if
Yes.
you're fearful of your milk supply.
Totally.
Girls,
Totally.
you got this, ladies.
Yeah, your body is made to I mean, I always think about it, I'm like, "Well, what if formula wasn't an option?" Like, many, many years ago, it wasn't an option, so it was like, yeah, there were still people that didn't have the right milk supply, but you you tried to make it work. You did the best you can with what you had, and yeah,
Literally.
there's
Or you would hire someone to feed your
yeah,
baby
yeah,
in like wet
like
nurses. And
wet
I could
nurses
find
and stuff.
all the time. I'm like, I could, that's one thing. I'm like, I can induce lactation right now. Like, I'm a woman, you know what I mean? Like, it's
Yeah, it is
like,
kind of amazing to think about, because yeah, I don't know if our listeners know that, but there's something called, like, relactation or, like, induced lactation, like, if you didn't carry your baby, but let's say you wanted to, like, if you're in a same sex couple or something, you're like, "I wanna breastfeed," you can try to you can sometimes by taking hormones and different things, or but also it's from pumping, like, you can try to induce lactation. It's wild.
or if you are like having some issue right after
Yes.
birth and you give them the bottle right away, and then maybe like someone in the course was talking about how they just didn't know any of this, and they had like an infant while they were taking the course and learned about
We
all the
started
benefits
pumping.
of breastfeeding, and
Yeah.
they got a support, and then like 5 months into the baby's life they induced lactation, and they were
That's
like, let's go. So
incredible.
it's like, let's
Yeah.
go, you know what I mean?
Let's
Like,
try. That's what I yeah. Like, I wish that I had more confidence of that when I was going through it with my son, like, 'cause I did end up having a full milk supply, but I had points of having a low milk supply, but how much of that was, like, my stress and, like, just worrying that, like, all the pumping and too many bottles and all this stuff, like and my mom used to tell me that. She would be like, Just you
oh
have the
god.
milk. Just don't worry
Yeah.
about it." But I think I always say, I'm like, it needs to be more of an art than a science. Like, it's really hard when you see all this milk in bottles and then you're trying to make that transition to then being on demand and trusting that they're transferring enough. And so that's why I really recommend if you have a late term preemie, like 36 to 39 even weeks, I would say, like, I would say if your baby's born in that range, which is a lot of babies,
Yeah.
um, get a lactation consultant to do a weighted feeding, which is where they come to your house, they take the baby down to a little dry diaper, they weigh the baby, then you breastfeed, you back and forth, however long, 30 minutes, however long, and you put the baby on your breast, or sorry, you put the baby back on the scale, and you can measure how much they actually drank. And, you know, don't be crazy, don't get a scale and do that yourself, like, do that with a lactation consultant, but, like, because it's only one moment in
Exactly.
time, and the lactation consultant's
That's what
gonna
you need.
take into account everything else, the whole picture, but
Yeah.
if it can give a lot of confidence that, like, "Hey, this is how long it takes, these are how many times I need to help him relatch, but I can get the baby being more efficient." And then once they're really efficient and you have a few feeds where you see that they transferred over 3 ounces, then you just let them go. Then you just say,
Yeah.
okay, on demand, just breastfeed the baby. Everything's fine. We don't have to be so worried about these numbers. But I think it can be really hard when you are going from seeing the milk to then trusting that they're gaining weight, you know?
Yeah. And if you are like, the kind of mindset that you need to have physiological birth of like, oh, my body was actually made to do this. Like, this baby was created by my body and of course another person, but I've been carrying this baby, like my body is actually made to do this. Same mindset that you can bring into breastfeeding. So if you develop that
Yes.
during your pregnancy, then it will just transfer over to breastfeeding, and it's like
Yes.
this beautiful thing.
Yes. So I hope, yeah, I hope this talk has made us like, I really love everything we touched on. I hope that it's helped people know like when there are legit reasons to intervene and like supplement or get a lactation consultant to assess things. But like, I do really think that's why we have a job because we need to be on your team to help you assess all of those different factors so that you're not a lot of times what happens is you go to the pediatrician and they say, "Oh, they're not gaining weight, just supplement with formula." And they don't even tell you to pump. And so then your milk production gets sabotaged and then you're just like, "Okay, like, it didn't work out for me. Like, I don't have enough milk." And that's what I'm trying to prevent is like, okay, your body can do this if you have the proper person giving you the right advice to, like, get through the efficiency problem, because it's
Uh,
usually a temporary thing. It's usually the first couple of weeks that the baby's not that efficient, and sometimes it's as easy as feed more frequently because I've had a mom before be like, "Oh, well, I'm feeding them every 3 hours and we just do 20 minutes because they told me just 10 minutes on each side and then the baby's not gaining weight and everyone's concerned. It's like, "Oh, well, just feed them more."
but
And
yeah,
then the baby's like she's like, "Oh, every time they cry I should feed them?" Like, "Yep." And then they're like, "Oh, magically they're gaining weight perfectly now."
yeah, even before they cry, because it's hard to get a good laugh before they start
True.
crying. I mean, when they're
Yes, that's a
crying. So
late cue. That's a yes.
yeah, exactly. Yeah.
But
So
the
just
this
like
poor mom was thinking, like, "I have to wait to the 3-hour mark and dealing with a crying baby." It's like, "Ugh, no, just
you
feed
don't have to do
on
that.
demand." And if you and but so many people don't know these expectations or what's normal, and it is shocking how frequent it is in the beginning, but just know that it's not that frequent forever. It's just in the beginning while they're not as efficient and while they're working through these issues. So, I
And these yeah,
No, you
go
go.
ahead. But these
You go.
providers are like I mean, I can guess well-meaning. They're like, you know what? Just let's make it easy on you. You're gonna have a hard time. Let's just supplement, and like they're not trying to like um,
Sabotage your
sabotage
breastfeeding.
you, but also you have to be the one to be like, that's
No,
why
I
we
want this.
have this podcast exactly to be like, oh no, 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 no. I'm gonna problem solve. Like I can figure it out like
There are
because
other options.
there are other options, but your pediatrician might not know that. They get like
Yeah.
very
And that's
little.
why I always hope that they just refer to lactation consultants when and hopefully the mom that really wants to breastfeed already knows that lactation consultants exist. But I think a lot of people, most moms I meet say, like, of course, I'll have some that are like, I definitely wanted to breastfeed. And those moms are going to always get the help, right?
Yeah.
But I feel like a lot of moms are like, I've heard breastfeeding can be really hard. I want to do it, but I'm okay at the end of the day, like, fed is best. I want the baby to I don't wanna kill my mental health, and I don't want my baby to not be gaining weight, so I'm okay with supplementing if I need to, and that is totally fair. I just think that if you know that there's a way to work through the issues, then you should at least have the opportunity to do that, and then if it's still necessary, no worries, but, like, a lot of moms okay, and another thing is that the pediatricians don't have time to really intimately know your goals and what you wanted. Like, even me as the lactation consultant, like, have to make it a point to be like, "Hey, before all of this, like, what was your goal for feeding? Like, did you want to breastfeed on demand? Did you want to breastfeed with like 1 bottle a day? Are you going back to work soon? Like, what is feeding gonna really look like for your family? And how important is this to you?" And then if that mom's and I'll see this a lot when I do my hospital days, um, if the mom's like, "No, like, I want this. Like, I'm not going back to work for like 6 months. I want to on-demand breastfeed." Then it's like, "Okay, then I'm gonna give you all
Yeah.
the
Oh, yeah.
everything. Like, you gotta pump this much. You've gotta do this. You've gotta get the milk supply in. Then
Yeah.
go home, go see an outpatient lactation consultant, like, do all the things, and you can make it happen." So I feel like the pediatricians probably have their quick advice that they give because their job is just get the baby gaining weight. But you need someone more tailored that is really going to help you work through the efficiency and oral motor challenges that a lot of babies have in the first
Yeah,
month.
and if you're listening to this podcast, you're already motivated enough. You know what I mean? Whether you've had one baby and you want to have more, or multiple babies and you want to have
But
more.
share this with a friend that doesn't know anything about breastfeeding, you know? Yeah, because people need to just know what it might look like in the first month. And then it gets so easy, but you have to work through these challenges.
And that's
Yes.
what we heard in our last season with like almost every woman. They were like, it gets easier. Like,
Yes.
yes, okay, the 2 weeks are hard, but it's like it gets easier, which the supplementing would be the opposite. Like it's simpler in the beginning, but then it gets more challenging when you're having just different health issues come up, or you're having to wash bottles, like basic
Yeah.
things. You're having to mix formula, like all of these things. And breastfeeding, you're just like, let's go,
Oh, here we go.
do your thing.
Oh,
Oh,
great
so good.
podcast. Love
Let us
chatting
know if
about
you would
this.
like us to keep talking on this topic or go more into oral motor function or what's normal. But we really enjoyed getting to share this with y'all. And yeah, that's what you think.
Yes. Thank you. Thanks, Catherine.
Thanks, Abby. Bye.
Bye.
We're so happy you joined us for this episode of the Feeding Hour. If you are enjoying the podcast, please leave us a review or send it to a friend. It helps these feeding stories go out to the public and to new moms that might feel alone. If you have any feedback for us on how we can improve or would like to share your story, please email us at thefeedinghourpodcast@gmail.com. Also, if this podcast has helped you and you're in a position to give back, you can now support us on Patreon to help keep the Feeding Hour alive. Just $5 a month would really help us to keep it going. The link is in the show notes, and we would so appreciate it. Until next time, happy feeding.